Stages of dementia are often classified as early, moderate, or advanced. There are 10 symptoms of early dementia. Memory loss that disrupts daily life. This type of memory loss refers to forgetting recently learned information that disrupts daily life, such as forgetting important dates or events, asking the same questions over and over, and increasingly needing to rely on memory aids, e.g., reminder notes or electronic devices. They often rely on family members for things they used to handle on their own. These impairments are different from typical age-related changes, like sometimes forgetting names or appointments, but remembering them later. Challenges in planning or solving problems. This includes changes in an individual's ability to develop and follow a plan or work with numbers. For example, they may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. This is more severe and frequent than typical age-related changes of making occasional errors when managing finances or household bills. Difficulty completing familiar tasks. This includes trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. This symptom is different from a typical age-related change of occasionally needing help to use microwave settings or to record a TV show. Confusion with time or place. This includes losing track of dates, seasons, and the passage of time. Individuals may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. This symptom is different from a typical age-related change of forgetting the date or day of the week, but figuring it out later. Trouble understanding visual images and spatial relationships. Vision problems that include difficulty judging distance, determining color or contrast, or causing issues with balance or driving can be symptoms of Alzheimer's disease. This is different from typical age-related visual changes. New problems with words in speaking or writing. Individuals with Alzheimer's disease may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have trouble naming a familiar object, or use the wrong name, e.g., calling a watch a hand clock. This is different from a typical age-related change of having trouble finding the right word, misplacing things, and losing the ability to retrace steps. A person with Alzheimer's disease may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. They may accuse others of stealing, especially as the disease progresses. This is different from a typical age-related change of misplacing things from time to time and retracing steps to find them. Decreased or poor judgment. Individuals with Alzheimer's disease may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. This is different from a typical age-related change of making a bad decision or mistake, once in a while, like neglecting to change the oil in the car. Withdrawal from work or social activities. A person living with Alzheimer's disease may experience changes in the ability to hold or follow a conversation. As a result, they may withdraw from hobbies, social activities, or other engagements. They may have trouble keeping up with a favorite team or activity. This is different from a typical age-related change of sometimes feeling uninterested in family or social obligations. Changes in mood and personality. Individuals living with Alzheimer's disease may experience mood and personality changes. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, with friends, or when out of their comfort zone. This is different from a typical age-related change of developing very specific ways of doing things and becoming irritable when a routine is disrupted.